Are you looking for art that inspires and gives back? Check out Artery Inc., a Milwaukee-based, woman-owned company blending anatomical art with purpose. From tees to stickers, their designs celebrate the human body and support real causes. Right now, shop the End Violence in Healthcare campaign, made in partnership with PulseCheck Wisconsin. Proceeds help raise awareness and push for safer workplaces for healthcare workers. Visit arteryinc.com and wear your support with pride. That's arteryinc.com. Art, wellness, and action. Welcome to PulseCheck Wisconsin. So healthcare is not political when you are the patient in the hospital bed, and it's not political when you cannot afford your medication. Certainly not political when hospitals close and communities lose access to care. Here in the state of Wisconsin, the decisions that are made in Madison, we've seen directly affect the health, the safety, and the stability of our communities, and that's why conversations like this matter. Welcome back to PulseCheck Wisconsin. I'm Dr. Chris Ford, emergency physician, advocate, and your host. And today we are talking about healthcare access, the state budget, and what leadership could look like during a time in which our country is very divided. Today I'm joined by former Lieutenant Governor and current candidate for governor of the state of Wisconsin, Mandela Barnes. Mandela, welcome to PulseCheck Wisconsin.
Dr. Ford, thank you so much for having me. I really just appreciate your advocacy and grateful to have a chance to have this conversation.
Absolutely, man. I appreciate you being here. So we'll go ahead and kick off here. You know, it is a wide field on the Democratic side in terms of Democratic candidates. And we were waiting, is he going to jump in? Is he not going to jump in? There's been a lot of conversation back and forth, right? But you finally made a decision to jump in. What made now the right time for you to run for governor?
For sure. This is a moment where things could not be more difficult for people. It's a critical moment for our entire country, but specifically our state. And the tough part is that you look at a state like Wisconsin that has typically led the way before on so many issues. We've been bold. We have been at the forefront, but we have been held back by this Republican-controlled legislature, the same legislature that I served in. It was a difficult time back then. It's one of the reasons I ran for lieutenant governor, because I knew that we had to make something happen, at least if we change the narrative in the way that we were speaking as a state. And so I look at this race and the urgency of the moment, the sheer urgency of the moment. We have a president who hasn't done a single thing to make things better for people. In fact, he's made things worse. And we need leadership that's not just going to stand up to Donald Trump. Like that is in vogue, standing up to Donald Trump, right? Like that is a popular thing to do. But what we also need is people who are going to provide real solutions and bring experience to governing. I'm proud to have been right alongside Governor Evers during my time in office. We worked on a number of issues. I guess that number is limitless if we're being honest. I really appreciate the trust that he had, whether it was working side by side or the things I got to do on my own. Had a chance to work with a number of public health officials with our Health Equity Council that I helped get established. I served on the Health Equity Council. We provided real solutions. We provided some grants across the state. The work we did during the pandemic was hand in hand with health professionals across this entire state. And those relationships that I've built, they don't exist anywhere else in this campaign on either side. And that's why I'm excited for this opportunity to continue to grow those relationships until Wisconsin is the healthiest state in the entire country. I had a chance to lead our climate change task force. And most people look at it, clean energy and conservation. Yes, of course, but there are public health impacts. And we have public health professionals that work with us right alongside us in the commission of that work.
Yeah. And you mentioned it, right? So you served on the assembly, you served lieutenant governor, and those experiences matter, those relationships matter, especially when you're talking about maintaining, right, the state of Wisconsin and how we move forward in the setting of such division right now and such limitation that we have. How do your experiences, in government here in the state of Wisconsin, how do you think those experiences will shape how you will lead if you are elected governor?
Man, I can tell you that having been on the legislative side and having been on the executive side, we've bumped into a bunch of roadblocks, a lot of windows that just wouldn't open for us. And let me say, one window or one door closed might lead to another. Sometimes a closed door led to another closed door and another closed door, at which point you just got to find a window. You got to find some way through. And that's exactly what we've been doing. There's been so much trial and error. Given this moment that we're in, I talked about the urgency. We don't have time to try to figure it out in the first 90 days on the job. We have to be ready to go on day one and bring that experience through trial and error that we have already been through, knowing what has worked, knowing what hasn't worked, and knowing what we have a unique opportunity to at least explore.
Yeah. On this show, you talked about it before. We talk about healthcare through the lens of real people and real outcomes because that's what really matters here, right? You hear a lot of the noise outside, but here in the state of Wisconsin, we're focused on real families, real outcomes, and real circumstances that people are in. You've worked on Badger Care. Let's talk about Badger Care. What is your current vision for Badger Care expansion or Badger Care in the state of Wisconsin in your first 100 days of being governor?
We'll always point to the fact that we are one of 10 states that has yet to expand our Medicaid program under the Affordable Care Act. We're 15 years behind right now. And actually more than 15 years behind. We're like 17 years behind.
Yeah.
And the idea that, unfortunately, Republicans in the legislature have denied people the access to care that they deserve is pretty shameful. It's embarrassing. And not just the first 100 days, this is a day one priority. And I've been very adamant that we'll go in a special session the very first day, right after legislators are sworn in, because it is that big of a priority that there needs to be a vote on Badger Care. And I've also made it very clear that if a state budget comes across my desk and we have yet to expand Badger Care, that budget will not get signed. It will be vetoed. And also, I mean, another thing too, like in the legislature, like during my time out of the legislature, I worked with an advocacy organization called State Innovation Exchange. We worked on policy across the states. And one of the things in particular people were working on back in 2017 was a public option for their Medicaid. Like these are states that had already expanded Medicaid, and now we're opening the doors for a public option, which is absolutely necessary, absolutely needed here in Wisconsin. But this is 9 years ago. We're talking about states were implementing it. Nevada's getting, their program is rolled out, and I do truly believe that in order for us to be able to lower costs and increase access, the public option will help put some competition in the private market.
Yeah. One of the things that, we've invited folks on to talk about Badger Care, Medicaid, the state here in Wisconsin. And we've invited people on both sides of the aisle, right? We've only got a certain subset of people because the folks on the other side don't want to talk, apparently. But one of the things that they bring up just commonly is long-term budget stability concerns, right? So that's the conservative standpoint. In your case, in your estimation, how do you expand access while still addressing those concerns about long-term budget stability here in the state of Wisconsin?
Well, I can tell you long-term budget stability has already been, we already see the example of it. We have a surplus right now in Wisconsin. And with that being said, it's hard. I don't, I just don't understand how Republicans in the legislature can sit comfortably with a surplus while so many people are suffering. You hear some heartbreaking stories. I had a roundtable discussion in Cadott, Wisconsin about tariffs. We were talking about tariffs, and the conversation shifted to healthcare and the grand conversation of expenses overall and everything just costing more. The guy told me that he got the letter informing him that his health insurance premium was going to increase from $275 to over $1,600. And this is because of the vote to not extend the Affordable Care Act tax credits. Tiffany, who probably won't come on the show because, I'm sure he doesn't want to answer that question. He voted against extending the Affordable Care Act tax credits. In the state legislature, he voted against accepting the Medicaid money. This is a person who has been anti-public health, who has been anti-health overall in terms of this state and our ability for people to get the care they need. And the Cadott story, not isolated at all. We all know somebody with a healthcare story. I was talking to a woman in Green Bay, first week of the campaign. She mentioned that, she had a slip and a fall, something that could happen to anybody, an accident, and her bills started to pile up. They continued to pile up, and she could not afford to stay in her home anymore. She had to move. She had to leave her community. She had to uproot, upend her entire life because of something that could have happened to anybody. And so these conversations, they're not abstract. They're not hypothetical. This is real life for so many people. And all of us are very close to a healthcare story, but all of us
Mm.
are one emergency away from our own healthcare story.
And that's the truth. We see it in the ED all the time, right? You see people who are doing fine and all of a sudden get a cancer diagnosis, or all of a sudden have a car accident driving to work, and it changes not only their physical health, it changes their financial health too, right? So they have a situation where they're now putting their savings into their healthcare bills. They're cashing out their 401ks because they have to. You have elderly parents that are coming up now too, right? Have a fall, have something like this. We see this over and over and over again. And like you said, in the setting of where we have a surplus in the state of Wisconsin, it almost seems fiscally irresponsible to allow these situations to occur when you have so much on the back end, on the shoulders of our patients that we're seeing in Wisconsin as well as our citizens.
So it's certainly fiscally irresponsible. It's also our money.
It's
It's
up
our
right.
tax dollars that went to Washington, D.C. that are coming back to us. So yeah, it's fiscally irresponsible on both sides.
Yeah. Yeah. So we have a lot of gaps here in Wisconsin. So rural care gaps, mental health, maternal health, if we've seen in recent years, workforce shortages. We've seen nationally, and myself and a couple of my colleagues have done numbers of interviews about folks reluctant to seek care in their clinics, dialysis, et cetera, where ICE is stationed in many of these states. From your perspective, where are the biggest healthcare access gaps in Wisconsin today?
Man, so they exist all over. And I remember running for lieutenant governor, I would talk about the healthcare mismatch because there are areas where there are hospitals and clinics, but people don't have health insurance or,
Hmm.
can't afford to go to a visit. And there are some areas of the state where people do have coverage, but a clinic or a hospital is an hour drive away. So this mismatch exists all across Wisconsin, but more specifically, one of the bigger problems we have is lack of access to one postpartum care. We're one of like two states. It's just us in Arkansas, I want to say, that doesn't have postpartum coverage under Medicaid. But also you look at, you know, rural communities because of the lack of access to health care or health coverage and the lack of Badger care expansion where maternal health care is in complete free fall. It's been a crisis since like I was in the legislature. These places are closing their doors. Expecting mothers can't get to an appointment. God forbid you have an emergency, you have to go into delivery you weren't expecting, and it takes an hour to get to the hospital. You can imagine what kind of tragedy can come as a result of that.
Absolutely. You travel across Wisconsin, and you said, you've been everywhere on this campaign, even during your campaign as lieutenant governor as well, and you talk directly to voters. What are some of the top two or three issues that people are consistently bringing up, both in the rural setting as well as here in Milwaukee and the urban setting as well?
Been all over this state, going to continue to get all over this state, even when I was out of office. Had the great fortune and opportunity to travel the state. What I will say is, again, healthcare does come up organically. I don't have to bring it up to people. I We were at an event doing a roundtable for healthcare in Racine, and before the event, we went to go grab coffee. We're sitting at the restaurant, and our server, she just went into a long conversation about healthcare. We told her, why we were there. Actually, no, we didn't tell her why we were there at first. We were just having random conversation, and health insurance came up. I mentioned my name and why I was there, but this is how organic healthcare conversations come up. Overall, just cost of living, because as things get more and more expensive, wages have not kept up with that. So cost of living and quality of life, it all goes together. And people are, I mean, those are two, but another thing that comes up as well is our schools. Our public schools are not fully funded. And because of the fact that the legislature has abdicated their responsibility, what we see is school districts and communities going to referendum every election cycle, almost every year. It feels like there's an historic number of referenda questions. And these are people who are voting to raise their own taxes and not to build a new stadium. We're talking about just to keep the doors open in these school buildings. And with these referenda questions and the increase in property tax, people have had enough. They're getting sticker shock, and it will not end until the legislature decides to actually prioritize our students, to actually consider the future of this state. And ensuring that there are opportunities for high quality education to be received, to be accessed in every single zip code.
And like you said, every single zip code, we try to draw corollaries on the show from that unite the urban and the rural communities because we see a lot of these issues are joined at the hip for both communities here. How do you make policy as governor that works or advocate for policy that works for urban and rural communities?
I'm glad you brought that up because, there's always a discussion about this urban rural divide. I'm using air quotes for people who
Hmm.
are listening only. And I'm using the air quotes because there's so much more that unites us than divides us. And every community I've traveled to, every community I've visited or lived in, it's been the same exact thing. People want a good school to send their children to. People want to be able to go to the doctor, not worry about a surprise bill. And people want a good job that puts food on the table. It's pretty simple, pretty plain, but those opportunities have been taken away from far too many folks. I talk about my grandfather. You know, I talk about my parents all the time, but my grandfather moved to Milwaukee after his service in the Navy in World War II. He got a job as a union steel worker, went in one day, came out 30 years later, and retired with dignity and relative comfort. The opportunities for people to be able to do that this day and age, they just don't exist the same way. It is wild to think that in the late 1940s, a black man could move from Louisiana to Wisconsin, find opportunity, build a life. And that wasn't just him, right? Like it was an entire middle class that existed either at that same exact factory or factories that are similar. And so what we are witnessing right now is, or not even right now, sorry, I need to go back decades because that factory closed a while ago. And those jobs didn't just, grow legs, and the factory didn't just grow legs, hop on a plane or a boat and go overseas. It was corporate greed. And that corporate greed closed down factories just like that all across the industrial Midwest, but it happened particularly with a devastating impact in Wisconsin. And it is no different than the corporatization of our family farms here in Wisconsin coming in based on greed. They're showing up, destabilizing entire rural economies, pricing people out of competition, making it so hard, squeezing communities. And to that, I say the big problem that we have, or one big problem that we have, is the fact that many of these corporations are still incentivized. They still get tax breaks. So another part of my day one agenda is closing those loopholes that allow wealthy corporations to get away without paying their fair share. When I say get away without paying their fair share, of course, they need to pay their fair share in taxes, but also you can't get incentivized if you're shipping jobs overseas. You shouldn't be incentivized if you're outsourcing Wisconsin jobs to artificial intelligence. You shouldn't be incentivized if you have these crazy ratios of CEO pay to average worker salary. We have to ensure that working people get a fair chance, and we have to make sure that the people of Wisconsin are not continuing to be taken advantage of.
And people first. This country on a national level feels deeply divided right now, and there's a lot of reasons for that. From your perspective, what is driving that division?
So there are a number of things that are driving that division. We can go back to the conversation of greed because you have people who are struggling that are pointing a finger at each other as if they're the problem, as if they are each other's nemesis, as if either of them have worked to keep each other down, which couldn't be farther from the truth. And as people who are fighting for basic survival continue to point at each other, all that means is it's another day that the most wealthy and the most powerful get away unchecked, off with the bag, taking the resources, the money. And as I mentioned, wages haven't kept up with inflation. They certainly haven't kept up with the growth of the market. They haven't kept up. Wages certainly haven't kept up with the growth with the growth of the S&P. It hasn't kept up with CEO pay that is going through the roof. All these incentive packages that people are getting, while the people who actually do the labor that generate that wealth are forgotten about. They're disregarded. And so I will say what is driving that again is greed is one, but that also ties into power. It ties into politics because politicians have to create the pathway that allow for the wealthy to get away without paying their fair share. It's politicians that cast the votes that give these massive tax breaks and give people unchecked power without raising the wages and giving at least some power to the working class. At this point, the distance between labor and capital could not be greater. Everything is going towards capital and hardly anything to labor. So when you have elected officials that make those decisions that make it harder for working people to get ahead, you have this explosion of gross wealth and greed that continues to leave people behind. And it creates political division because there are politicians that are going to go along and support it because it keeps them in office. And everybody else pays the price and everybody else has to deal with the impacts of that division.
Exactly. And you see it over and over again, especially here in Wisconsin. You see a lot of mistrust right now, right? People don't know who to trust. They don't know if they can trust at the federal level, at the state level, what the ulterior motive is. How do you, as governor, rebuild that trust in institutions, including the government, including in public health here in the state?
Everywhere I show up, I level with people. I let them know exactly where I come from, let them know exactly what my life has been, the good, the bad, the otherwise. I was born right on 26 and Locust, the Hart 53206 zip code, our state's poorest, our nation's most incarcerated. I'm a proud product of Milwaukee Public Schools. I spent my entire life here besides college. Went to Alabama A&M University, finished school, came back home. I worked on a campaign along the way, but I came back home. And I let people know exactly what my household was like with a father that worked third shift on an assembly line and a mother who was a public school teacher. I have been through the challenges that so many people are experiencing. I have been laid off from a job I thought I was going to have for a while and ended up, one day doing okay. The next day, applying for food share. I still have my food share card to remind me of those times, of those days, to know exactly and to never forget that people that I have gone through or people are going through. And sometimes people just need some help. People need some assistance. And as government, as the wealthiest nation on the entire planet, we should be able to provide that support to get people back on their feet. I have, I've had energy assistance, unemployment, you name it. The list goes on. Almost every benefit program I've either qualified for or been a part of. And that's ultimately my North Star. It's what keeps me going. It's what keeps me grounded because we have to do better. And as much as, I wanted out of that experience, I know that is the case for other people. I know that people aren't looking for a handout. People want to be able to be supported in hard times. And right now, some real hard times people are dealing with. And I know that as we have led the way so many times in this country before, this is a moment where we can get folks out of this economic rut.
Absolutely. Absolutely. Manila, I appreciate you coming out and having this conversation with us. But before we go, where can people follow your campaign? Where can people learn more?
Yeah, people can learn more at mandelabarnes.com. I'm on social media at the other Mandela. And I hope we get to have a chance to talk again. Would love to, connect with you in person, sit down, man. 'Cause I really appreciate this conversation. I appreciate the work that you're doing.
Absolutely, my brother. Always a pleasure. Well, thank you again for joining us on Pulse Check Wisconsin. These conversations matter because policy is public health. Leadership and affects outcomes, and informed communities make stronger decisions. I'm Dr. Christopher Ford. This has been Pulse Check Wisconsin. Thanks, bro.
Hey, man, take care.
As always, take care of yourselves, take care of each other, and if you need me, come and see me.